carbon monoxide, chemical asphyxiant or systematic asphyxiants produce ill health, disease or death by specialized mechanism, such as by combining with the hemoglobin. It is a colorless, tasteless, non-irritant gas which is lighter than air, insoluble in water. Okay, it burns with a blue flame, produce carbon dioxide. Mechanism of action is absorbed after inhalation. Greater affinity of to hemoglobin, about 200 greater than that of oxygen. Affinity. Leftward shift of the oxygen hemoglobin dissociation curve. It is eliminated. It is not metabolized in the body also. Sources is a fire in confined spaces. Mechanism is oxygen CBO and cytochrome oxidase inhibitor that glucose. Then some postmortem findings you can see. Postmortem is cherry red color of skin, conjunctiva, mucous membrane, nail beds, all internal organs, silent features. If carbon monoxide poisoning is more than 40%, dark colored individuals also, there is pink color. In brain, consistency is to retain its shape. Firmer than normal, retain its shape better after removal from skull. Meninges shows hemorrhages, basal ganglia, necrosis, cavitation, especially in a globus pallidus, putamen and delayed the considered most characteristic. Other areas affected are cerebellum, cerebral cortex, hippocampus, because of decreased vascularity in watershed blood supply. Meninges shows hemorrhages, cavitations in globus basically, retinal hemorrhages. Lungs shows congestion, pulmonary edema, pleural hemorrhages, bronchopneumonic consolidation, heart, pericardial hemorrhages, frank MI, especially in the presence of pre-existing coronary artery disease. Blood is a fluid. Serous effusion in all body cavities, skin blisters, ganglion cell selective necrobiosis, and in white matter there is ring-shaped hemorrhages with widespread edema, punctiform. Ganglion cells also has selective necrobiosis. Red coloration more than carbon monoxide more than 40%. Differential diagnosis called on decomposition dark green and brown color. Medical importance is accidental carbon dioxide poisoning during winter, who slept in a small room with a coal burning inside or warmth. Then susceptibility of birds and mice. Bruises formed during or carbon monoxide is a cherry red color. In burns, postmortem production, employer-based liability. Then in chronic carbon monoxide poisoning is detected by diagnosed by PET. Decreased metabolism, orbitofrontal, dorsolateral, prefrontal cortex, temporal lobe syndrome. And Farangante hematoprotein, myoglobin, this oxygen dissociation, left oxygen dissociation curve. Fatal dose is more than 60%. Increased polycythemia, increased hematocrit, cutaneous blisters, pulmonary hemorrhage, congestion. Soot particle in the throat, retain shape, consistency, increased thermal. Diagnosis by carbon CK, increased in rhabdomyolysis, syncytiography, troponin T, cardiomyonecrosis, increased pH, metabolic acidosis, plasma glutathione, etc. Thank you.